YouTube, it's Marita from the Nurse Lounge, and welcome to another video. I am doing this video per student request. So I received a DM from a student who had a question regarding a certain topic, and she wanted some advice. And so I am here to give that advice. So we're going to go ahead and jump right into this. Go ahead and give her some tips, because I'm sure that there's other students or even nurses who have experienced this and want to know exactly how to go about handling this situation. So the situation is this: she wrote to me and said basically that she's in her preceptorship at a university. You know, she's about to graduate here soon, and she has noticed that being African-American student, she is not getting the same experiences, shall I say, as her counterparts. So the example that she provided for me was that a doctor asked her white peer, her counterpart, would they like to come and see a procedure. However, they were standing side by side and did not ask her if she wanted to see the procedure as well. So she felt uncomfortable because of the fact that that physician asked the white student to see this procedure, but not her. Her preceptor then jumped in and said, hey, would you like to go see that procedure? And then she was able to step in at that point, but not because the physician himself or herself, I'm not sure if it's a male or female, asked her, but he or she did ask her counterpart. So her question was this: how do I handle those kinds of situations? And basically, what tips should I provide regarding that? And I wrote back to her saying, you know what, I would like to do a video on this, because I know there's other students who are experiencing this, or even nurses currently who are experiencing this. And I myself have experienced this as well, as being a new nurse, and even new in the sense of maybe I'm not new in terms of years of experience, but maybe I'm new to a certain unit or new to a certain floor or just type of job, things like that. And when the demographic is very much one way versus another, and you come in and they have to deal with you and your just you being who you are, naturally who you are. So these are the tips that I have for her and other students that that may encounter this. Basically, it's like this. First of all, know that this is pretty much how it's going to be, and what you have to do is basically simply say to yourself, I will not let this get to me. This will be true for you in your real world of nursing, where you will be excluded from certain things. But as it relates to what you have going on right here today in terms of your preceptorship or other experiences like this, and she did say that her peers, her same race peers, are going through the exact same things. They have similar stories. So my advice is this: remain encouraged, or be encouraged. Know that this is temporary. Know that you will get through this process, and graduate and do just fine, and you will go on to your next adventure. But with that being said, you're asking about the here and now. You will have to look within yourself to say, okay, you know what? I'm not going to let this get to me, which is hard. I have to admit that's very hard to do. You have to say, I'm better than this, and that, you know what, I've paid for my schooling just like she or he has paid for his schooling, and I basically demand to get the same experiences that my counterparts get. So in that particular situation that she was talking about, where the physician said to the counterpart, hey, would you like to come see this procedure? Then I would have said, if you don't mind, I would like to see this procedure as well. And you have to be assertive. Now, they already think a certain kind of way about people of color, in terms of, especially women, in terms of being very assertive, of us being sometimes angry or things like that. But I have to say that you've paid for the same education that your counterpart has paid for. So with that being said, you need to make sure that you are getting the same education that your counterpart has paid for. You will always have to work harder. You will always have to prove yourself. You will always have to get the higher degree to get the same job that someone with a lesser degree has. That is just kind of how it is in really in the world, not just nursing, but in the world itself. I myself am pursuing a doctoral degree, and there's people who have, let's just say, not forget about the doctoral degree. There's people who the job requires a master's degree, and I would have to have a master's degree in order to get the same job that somebody with an associate's degree has currently. So just know for me, the criteria for us, the criteria has always been different. It's always been different. You just have to know and understand that. But first, like I said, be encouraged. Number two, be assertive. Simply, and that's within yourself. These are things within yourself that you have to work on. And even when you go to be assertive, you're not going to be comfortable with that at first if you're not used to doing that on your own. So you want to simply say, in a professional way, let me make sure I emphasize professionalism. Professionalism is very, very, very important. So do not come across as being rude or disrespectful to whoever the person happens to be. But you have to demonstrate that you are just as capable of learning and understanding as your counterpart. So walk up to the situation, say, hey, would you mind if I observe this situation as well? Allow him or her to be rude to you. Meaning they're either going to say nothing. And if that's the case, you still walk up there and stand and watch. Either they're going to say no, which that's probably unlikely in front of the counterpart, or they're going to say sure, but they don't really mean it, but you're going to go up there anyway. So you always, 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 always make sure that you are in the know. If someone has a question about something, hey, what I'm just giving you something generic. What procedure is this, or what procedure would you use for X, Y, and Z? Make sure you know it. Make sure you know your content. Make sure you know what's exactly going on with the patient population that you're taking care of at that moment in time. That will take you a whole lot further than just, sitting back and doing nothing, because that kind of plays into what they think about us anyway. They think a lot of us are lazy. They think a lot of us are not intelligent. Actually, they know that we are intelligent, but the thing is, some of us are not, and we don't act accordingly. But keep in mind, laziness happens in all races, all demographics. Not educated or not smart happens in all races or all demographics, but sometimes we get pigeonholed into making us feel like we are that one group of people that aren't like that. But I want to empower you that you got to nursing school somehow, some way. You got there based on your merit. You got there based on your GPA, your scores, and your ability to hopefully, perform and be a nurse and be a great nurse. So with that being said, you need to make sure that you remain professional at all times, that you seek experiences. So that means, don't be the one who is, and I'm not saying this is this particular student who wrote in, but don't be the one who wants to hold up a wall. If there's experiences to be done, volunteer to go see them, volunteer to go do them. A lot of times they will come around to you if they see you are truly interested in what you're trying to do or what you're trying to learn. Even if you don't like the subject matter. So for instance, I'm an OB educator. I do OB in real life. And I tell my students, I don't care if you don't like OB. That's not really the point. The point is for you to come out learning certain skill sets, learning how to be a nurse, and then you happen to be in your OB rotation at the time. So I expect them to really come to clinical prepared to do OB, but be able to transfer that into whatever skill set they choose to go into. So organization, prioritization, and time management, as an example, are things that you need no matter what area of nursing that you choose to go into as a nurse. So be mindful of those things. Back to what she asked me, I would have to say, from my personal experiences, that I am one to, for one, if I know it, I know it. If I don't know it, I admit I don't know it. If I've made a mistake, I own my mistakes. If I want to learn something, I'm going to be front and center. So you have to be assertive. You have to be consistent. You have to know the material. You have to do the things that you don't think your counterparts have to do. But that's just how it is in this particular topic of nursing. That's how it is. You will always have to do more. You will always have to prove yourself. And I know I have a following of various races in terms of, or ethnicities in terms of my subscribers. However, I am answering the question that the student asked. And for anyone who wants to come and say something negative about, why is it always about race? Well, it is. It is about race for her because that's what she's going through. And so as similar to being in poverty, if you've never been in poverty before, you will not walk the walk that someone who's in poverty is going through. So if you've never been black before and you've never dealt with the black plight of what it's like to be African American and a woman and in nursing, you will never understand what students like her myself, I'm not a student, but actually I'm a doctoral student, but what we go through. You don't even realize what I go through as a doctoral student. And people are wondering, like, okay, so when I say I'm in school, they automatically assume I'm either in school to be an LPN or I'm in school to get my bachelor's degree in nursing. And so once I tell them, no, I've already done that. I've been a nurse for 15 years and I'm getting my doctoral degree. Then they're like, oh, you're getting your doctoral degree? Yes, I am. So that's kind of my point. You're going to always have people who think that you're not at the level that you are, but you have to show them otherwise. There's no other way to do it but to show them. If you're uncomfortable, you're going to be uncomfortable till you decide in your mind and in your heart that, you know what, this will no longer be a problem for me. This is their problem, not your problem. And when you start thinking of it like this is not my problem, this is their problem, then you will carry yourself accordingly and you will be assertive, you will be empowered, you will be encouraged, you will walk up to that clinical site and you will be on time and you will be the one who knows the answers to the questions when your counterparts didn't even know the answer to the question. You will answer the questions that the physician asks you in this particular situation. You will do all those things because of the fact that you would have known and you would have studied and you know your material. Don't be one of those students who complains about this exact same situation, but yet you don't even know the material yourself. So really, you're not setting yourself up for success. You're setting yourself up for failure, and you're feeding into the rhetoric in which they believe about you. That's the issue right there. When you are feeding into a situation in which they think that you're dumb, they think that you are lazy, they think that you are uneducated, and believe me, being dumb and uneducated are two different things, okay? So I know what I'm talking about on that. When they think that you have no work ethic, they think that you're ghetto, they think that you are nasty, they think that you're not punctual, they think that you're not professional, be everything that they say that they think you're not. That's what you do. Once you prove yourself to some people, a lot of them actually, they'll come over to your side, believe it or not. I've had a lot of situations where I've had to prove myself to be who I am. Now, am I proving it for them or proving it for me? Initially, I was proving it for them. I want you to see that I can do X, Y, and Z. But now I'm at a point in my career where I was like, you know what? I don't care what you think. I don't care. You could think I'm as dumb as whatever. You could think that I'm a CNA when I'm actually a doctoral student. I don't care what you think, because I carry myself in such a way that it's going to leave them questioning, wow, like, she knows what she's talking about. Wow, she's educated. Wow, she speaks well. And I do speak well for the most part. It's how you carry yourself and how you portray yourself to others. They will either come around or they don't come around. And actually, if they do or don't, that's not up to you. That's up to them. And so when you learn that the issues that they have with you has nothing to do with you and has everything to do with them, you will be more comfortable. You will turn your head and you will say, okay, you know what? If this physician, in this situation of this particular student, if this physician is not wanting to show me or teach me or whatever, then for one, see if you can find someone else, if you can. I've always told my students, go with whoever is who's receptive to you being there. And if no one's receptive to you being there, then just chop it up into an experience and know how not to act. Because one day you're going to be the one teaching someone else, and you want to know how not to act. Do not treat your students that way when you become and I don't mean that you're going to become an educator in the sense of going into what I do as a nurse educator, but you will, if you work in a hospital, you will have students on your floor 9 times out of 10. And it's a good chance that you may be the one that they come to ask questions. Don't treat them the way you were treated. Make sure you educate everyone. Now, when it comes to what I do as a nurse educator, I want everyone to be successful. I could care less what you look like. I want everybody who wants to be a nurse to be a nurse. But what I will not tolerate is disrespect, lack of professionalism, or anything towards me just because of what I look like. And that's kind of what this student is saying. She's being treated some kind of way where her counterparts are getting more attention, more time, more focus than she is. And she's saying it's strictly based off of what she looks like. And she said that her peers who look like her are feeling the exact same way. And again, like I said before, I've been there, done that. I've experienced that myself. As a student, I've experienced that as a nurse. I've experienced that as a doctoral student, even at this level. It does not go away. It is what it is. And the one thing that's kept me going is the confidence of knowing that, you know what, I deserve to be here because I earned my spot. Number two, I am educated, otherwise I wouldn't be here. Number three, I am a hard worker. I'm professional. I'm punctual. I'm all the things that they claim that we are not. And when you walk in with that kind of confidence, and you walk in with that kind of assertiveness, and you walk in with that kind of professionalism, and you walk in with that kind of knowledge base, meaning that you know the material, you are forced to be reckoned with. And that's what they fear. Remember that. That is what they fear. They fear people who are intimidated by you. That has nothing to do with race. People who are just intimidated by you in general are fearful of what you know and what you do, because that's power. Power equals control, which people who are intimidated by you don't like. I have been told by many people that I'm intimidating. That's not my problem. That's yours. If you can't help that I have a strong I can't help that I have a strong personality, number one. Number two, if you want me to change my strong personality, then you need to change your weak one. I have to accept you for being, in my mind, weak. You should accept me for being who I am, strong. Let's divide that, and we go from there. Again, these are very harsh, I wouldn't say harsh things, but this is very raw, shall I say, raw and uncut material that I'm saying here. And it's not going to be liked by everyone, and I'm not for everyone, and I recognize that, and I'm okay with that. When you are okay with who you are and being you, you will be fine. Then again, I'm not talking about being unprofessional. I'm not talking about being ghetto. I'm not talking about being loud, obnoxious, or anything like that. I'm talking about being confident in who you are in terms of your ability to speak, your ability to perform and do your job, your ability of how to interact and communicate with your peers. That's what I'm talking about. So hopefully this has been insightful for her and for anybody else who may be going through this. You have to remain encouraged. You have to understand where this feeling that you have in terms of her being uncomfortable comes from. They're making you feel uncomfortable. You need not to make yourself feel that way. You need not to allow it. You need not to allow them to make you feel a certain kind of way because they have an issue. That is not your issue. Let them deal with their issue because that is them. Remember, hate has nothing to do with you. This person doesn't even know you. This physician in this case doesn't even know you. Okay, so if he or she doesn't know you, what do they know what you're capable of? And so you ease your way on in there too. The same way your preceptor recognized that was not right. That's the reason why your preceptor said, hey, do you want to go up there and observe this procedure or whatever it was as well. You're going to have that from everyone. So just chop it up. You have so many hours of preceptorship to do to graduate. Get those hours done. Take what you can take from the experience, the good, the bad, and the ugly. Because honestly, all three of those, the good, the bad, and the ugly, is what shapes you into being the nurse that you're going to be. You're going to take the good and you're going to work with that. You're going to take the bad, you're going to work with that. You're going to take the ugly and realize that and work with that. Because you will see these people again. Not necessarily that physician, not necessarily those students, but you will see these type of people again no matter what area of nursing you work at and what hospital you work at. You're going to see this kind of people again. And it's going to be up to you to say, okay, you know what? I want to allow you to make me feel a certain kind of way. Period. Don't allow it. You are smart. You're beautiful or handsome if you're a guy. You are all the things that everybody said that you were not. And you're here to demonstrate that for yourself, not for anybody else. You're here. The reason why I'm getting a doctoral degree has nothing to do with anybody else. I'm proving it to myself that I can do something that I was told that I could not do. I'm doing something that I was told that, I was made to believe that I was not smart enough to do. There are certain times I've questioned that myself. I'm not going to lie to you. But here I am. I was selected out of 300 candidates. We have to interview for our spots. I was selected out of 300 candidates. 99 people got selected, and I was one of the 99 for my spot. I would say I earned that spot because I bring something to the table. Remember what you bring to the table, and the rest is and leave the rest of it there. If they can't meet you where you are, you need to change your circle of people that you're around. Also, watch the circle of people that you're around. If the people that you're around are not doing you any good, they're doing you harm. Sometimes they treat you the way they treat you because you are hanging around a circle of people who are bringing you down. And that has nothing to do with race. That's just your group of people. That's your circle. You need to let those people go. You're going somewhere that they're not going. Let them go. So hopefully this has been insightful. Hopefully I've answered her question. If this may be a new segment of mine. So this is basically a student advice. I don't know what I'm going to call this video yet, but basically it's student advice. It's something she wants to know, tips on how to tips on how to handle being uncomfortable when you are placed in a situation to make you feel uncomfortable because somebody has made you feel that way. Remember, don't let them make you feel anything. If you know it, you know it. If you don't, learn it. If you make a mistake, own it. Be assertive, be professional, and be encouraged. All right, that's enough for this video. Until the next video, you all take care. Bye-bye.